Welcome to CPE-HR presentation on healthcare reform. The presentation you've selected is specific to the large employer mandate. This presentation assumes that you are familiar with the healthcare reform, how to determine if you are a large employer, understand the definition of affordable coverage as it applies to large employers and mandate, and how to determine if you're a large or small employer. If you have questions in those areas, there are a series of presentations available from CPE-HR that will cover these subject areas as well. A couple of important items that everyone needs to take into consideration when reviewing the healthcare reform law is that the law is still going through a number of iterations, changes, guidelines and provisions continue to be issued, and oftentimes they change. And on July 2nd of 2013, a major change was made specific to the subject that we're going to speak about today, and that's the large employer mandate. This mandate was originally scheduled to go into effect January of 14, and it has been delayed until January of 15. We're not going to spend much time talking about the delay and its impact. There is a separate presentation available from CPE-HR that covers that aspect of the law. This presentation will focus on the provisions of the large employer mandate and how it applies to employers that are defined as large employers. I'm going to move now through the presentation and start to begin in the area of what the mandate requires of an employer. And if an employer is not providing certain coverages as defined by the law, then there are penalties. And the first penalty I want to go over is the penalty that would apply if an employer, large employer, does not offer coverage to employees. In this case, the employer is going to be subject to a penalty in the amount of $2,000 times the number of employees working 30 hours or more per week, on average in a month. There is an adjustment to that calculation that credits the employer with the first 30 employees. So if an employer has 100 employees and does not provide coverage, the penalty would be calculated as $2,000 times 70 employees. Important aspect of this penalty is that it's not tax deductible, and when considering the potential impact of the penalty, the cost of the penalty versus the cost of providing coverage, an employer would adjust this penalty for the net tax impact of the penalty versus the providing coverage and the tax deductibility of providing that coverage. So the couple of things that an employer would also consider is that in the absence of a employer-sponsored health care plan, it's common to see higher utilization in workers' compensation. So when an employer puts a plan in for the first time, it's not unusual to see some of those worker comp claims go down and coverage being picked up for those types of health care services under the health care plan. There's also a considerable aspect of providing benefits relating to retention of employee and morale implications. The second level of penalties that may apply to an employer is when they provide coverage. If the coverage does not meet the affordable standards as defined by the law, there could be an additional penalty, and that's what we're going to go over right now. In this case, an employer is providing coverage, but it doesn't meet the law's affordable test. And the affordable test, it's the last bullet on this slide, means that the benefit value of the plan offered by the employer does not meet the minimum 60% actuarial value, or the cost of the plan to employees exceeds 9.5% of the employee's income. If these two tests are not met, then the employer's plan does not meet the affordable standard. And in that case, if an employee was applied for coverage as an individual on the state exchange and received a premium subsidy, then the employer would be subject to this $3,000 penalty for each employee that receives that credit. Again, this penalty is not tax deductible, and it will be administered by the IRS. So employees will be applying for coverage, and the state exchanges will determine their eligibility for subsidies, and there'll be a verification of whether the employer offered an affordable plan or not to determine if this penalty would be applicable. Once again, on slide 5, I'm going to go over a couple of the rules around affordable as we just defined it: 60% actuarial value and cost the employee not more than 9.5% of income. If an employer plan is affordable, it meets that test, the employee can elect to enroll in the employer's plan or unsubsidized coverage through the state exchange. This is an important aspect of the healthcare reform law relative to employees being eligible for subsidies. In this situation, if an employee is offered an affordable plan by the employee is not eligible for a subsidy. They can still purchase coverage on the exchange, but they won't get a federal subsidy. This also applies to dependents of this employee. If the employer plan is affordable, the employee and the dependents are not eligible for a subsidy. If the employer plan is not affordable, the employee may choose the employer plan or coverage through the state exchange, and at that time they would be eligible for the subsidy. But this would also trigger a penalty of $3,000 for the employer. The next item we're going to talk about is, for large employers, this healthcare reform law introduces a number of new areas in which employees are classified and defines new eligibility standards for benefits. So some of the things that an employer needs to be aware of and understand and implement into their program is that the definition of a benefit-eligible employee is now 30 hours per week. Seasonal employees have also been defined as employees working less than 120 days in a year. Now, they can work more than 30 hours, but as long as they're working less than 120 days and are considered seasonal, then they do not have to be offered coverage. A new and important area is the variable hour employee. And a variable hour employee might have been considered a part-time employee in the past. These employees have to be identified specifically as variable, meaning they're not full-time, working 30 or more, and they're not seasonal. And based on the facts and circumstances at the date of hire, the employer cannot reasonably determine if the employee will work on average at least 30 hours per week. If we meet that requirement, the employee is considered a variable hour employee. Now, there's some requirements that the employer must fulfill relative to these employees, and those requirements are: the employer must monitor and measure the number of hours being worked by variable hour employees over a stated period of time, and this is referred to as the measurement period. The employer can select the measurement period anywhere from 3 to 12 months. Following the measurement period, there's an administrative period in which the employer would make available health insurance coverage and enrollment process for variable hour employees that have exceeded the 30-hour threshold of per week and are now eligible for coverage over a future period of time. That future period of time is referred to in the law as the stability period. And this is a period of time a variable hour employee is eligible for coverage following a measurement period in which the employee worked more than 30 hours on average. The stability period cannot be less than 6 months and not shorter than the measurement period. So these are some new concepts and new requirements that employers need to be aware of, particularly on classifying employees: full-time, variable, seasonal, and then work towards setting up a measurement period, administrative period, and stability period. The next slide gives an example of how the employer administration around tracking variable hour employees will work using the measurement period, administrative period, and stability period. The employer is given the opportunity to declare what their measurement period is going to be. 3 months, 6 months, 8 months, 12 months. It can be up to 12 months. In this example, we're using 12 months. And employees that have been employed for at least one measurement period get grouped together in the standard measurement period. And so that's what this slide starts with. All employees that have been employed for at least a year on January 1st of 15 would be measured during the measurement period of January 1st, 14 through December 31st, 14. That's the measurement period. And during this period, what we're doing is we're tracking the number of hours variable employees are working. And at the end of the measurement period, we determine if any of those variable hour employees worked more than 30 hours on average. If they did, they're going to be entitled to benefits for a future period of time. The administrative period for making that determination and enrolling the period can be up to 3 months. That would be January 15th through March 31st of 15. And the stability period would be the period in time in which benefits become available to these variable hour employees that have qualified, and that would run for a period of 1 year. New hires, their measurement period begins at the point in time in which they were hired. And so in this example, we're measuring a new hire that was employed on March 12th. The measurement period would begin April 1st of 14 and run for a full year through March of 15. And then you would apply the same principles for each one of these employees. As you can see, we're going to be measuring these periods unique to the employees. So there'll be a lot of different measurement periods in which you're applying specific to the employee and when they were hired. What's consistent is the length of the measurement period, the administrative period, and the stability period. After a new hire has been with the company for at least a full measurement period, 1 year in this case, then they would move into the standard measurement period with all other employees. In this example, we would overlap in that period and begin the second measurement period, January 1st of 15 through the end of calendar year 15, and measure the number of variable hours that this employee worked. So an employer needs to be looking at a number of things relative to full-time employees, variable hour employees, and seasonal employees. Of course, we've mentioned the definition of a full-time employee for health care plan purposes is 30 hours per week. An employer will need to also look at, well, do they provide a different full-time definition for other areas of their employee benefits, vacation, dental benefits, vision benefits, and other areas in which the employee would qualify for these benefits based on hours or some service measurement. We spoke about variable hour employee being defined as reasonably expected to work less than 30 hours and the seasonal at 120 hours. Another important aspect for large employers is the waiting period for a new hire cannot exceed 90 days. This is at the federal level. And you will see some variations by state. In California, California introduced a requirement that the waiting period be not greater than 60 days. And this, as of today, this this requirement appears to apply to both small employers and large employers. And so this is something that employers need to begin to look at modifying for their employee benefit plans beginning in 2014, specific to California. Some of the other things that the employer needs to be focused on and understand, and in many cases some of these have already begun to be implemented. Report healthcare costs on the W-2. Material plan modifications require a 60-day notice to employees. There's a new uniform summary of benefits coverage, which is a standardization of how a benefit plan is described to the employees. That began, that was introduced this year. An employer needs to really take a close look at how they're classifying employees, full-time, seasonal, variable. How are you using 1099s and defining those employees? This is going to be an area of great scrutiny by the regulators, classifying employees as 1099s, because that is one way to avoid providing benefits to employees, because a 1099 contract employee is not considered a full-time employee and not required to be included in the employer's health care plan. But regulators will be looking very carefully to make sure that employees classified as 1099 employees are in fact meeting that definition. Per diem employees is another definition that needs to be looked at very carefully, and in fact per diem need to be classified as either full-time or variable or seasonal. Manage and review work hours of variable employees, so that if the intent is to keep them below the 30 hours, then that information needs to flow through to you every single month, so you can monitor and then deploy your workforce to meet that objective. The 9.5% test is a requirement to avoid a penalty by not charging the employee more than 9.5% of their income for their benefit plan. So employers should be looking at their workforce and anticipating what the impact will be if they apply this 9.5%. The impact is how much will it cost the employer to provide benefits when the employee's contribution is limited to 9.5%. Update the employee handbook to reflect the law's requirements. Summary plan description should also be updated. There is a requirement to update the COBRA notice that would incorporate the mandate to provide employees with information about the state exchanges by October 1st of this year. That also gets incorporated into the COBRA notice. And another thing we're recommending to employers is that they establish a specific employee waiver relative to the healthcare law. And this waiver would include a statement that the employee was given an opportunity to enroll in an affordable plan, that the employee is aware that there's an individual mandate that requires that they have coverage or they pay a penalty, and the employee acknowledges their understanding of these requirements, and if they're going to decline coverage, they do so on this statement. So we think that's an important provision that employers incorporate into their employee benefit management. There are going to be some employer reporting requirements. The date was postponed a year, and we are expecting additional guidelines on what this reporting will be. Right now we're expecting that an employer will have to report detailed coverage, information about their employees, coverage they have, cost of that coverage, including dependent information, and report this for the period of time covering calendar year 2015. The report is expected to be due in January of 16, so there's some time, but thought should be given to, as soon as the guidelines are issued, what does this report require, and how can I get it set up and in place so that I can report the information when it is due. If you have a collective bargaining agreement, compliance with the healthcare law should be a top consideration as you're relooking at that agreement. stay alert on how penalties will be assessed. These are the penalties if a plan is not affordable or not offered. And then we're advising employers that they should expect increased employee inquiry regarding plans offered and information requested from not only employees but from state exchanges relative to what the employer is offering. Two other things that are also happening with the healthcare law, one is the Cadillac tax, and that becomes effective in 2018, so it's a few years away, but it's not an insignificant item. It's a surtax of 40% on premium over $10,000, $200 for single coverage, and $27,500 for family. Now, these amounts are relatively high compared to California HMO costs, but they're not very high compared to PPO plan costs. So this is something an employer will really want to watch closely and be aware of the tax and then try to plan to avoid paying the tax through benefit plan management. The next item is the non-discrimination rules. While the law did include provisions that indicated that employers cannot favor highly compensated employees, the implementation of this requirement, in addition to the guidelines and rules relative to the rule, have not been issued and have been delayed. It was originally scheduled to go into effect in 2010 and has been pended for additional guidance, and it's yet to be issued. So be aware of it and keep a lookout. This may require that you change some of the design, structure, offering requirements of your benefit plan. I'd also like to encourage you to contact CPE Benefit Specialist Team with any questions you have about healthcare reform. This team is well versed and can guide you through and the requirements of the law, as well as some of the administrative responsibilities related to the law. So this information is here for your reference. You have emails and phone numbers for the benefits team. The last slide on this deck is a reference slide, and it includes the 2013 poverty guidelines. This is here as a reference piece, and it really ties to the premium subsidies and credits that individuals may be eligible for based on income. So if you need to look up what the current federal poverty guidelines are, they're included here in the slide. Thank you for participating, and encourage you to call CPE if you have any questions. Thanks.